Well, welcome back, everybody. More delicious recipes in just a bit. But this week is National Infertility Week, and joining me now to talk more about what they do and how they can help is Dr. Thomas Reinardy from St. Gianna Clinic in De Pere. Good morning.
Good morning.
So let's start out with, can you tell us a little bit more about yourself?
I'm a practicing board-certified obstetrician and gynecologist. I've been living in Wisconsin pretty much my whole life, and I've recently joined the St. Gianna Clinic within the last 2 years after practicing in the Fox Valley for 27 years before that.
And I know, so 15 to 20% of couples, they are experiencing infertility, issues and stuff. What is your approach to that?
So it starts with a conversation, and it is a big part of a generalist approach to help figure out where to go with a workup for people. There's common myths associated with infertility. I think there's a myth that people believe that it's generally a female problem, when in fact the burden is shared pretty equally among couples. Now, there is definitely a need to focus on the female because the male's potential to fertilize an egg exists all of the time, whereas a woman's approach to fertility is extremely precise.
And there's a big difference in that. Now, walk me through that process of when you sit down with a couple and they're having some issues. How can you help them?
First, I like to understand how big of a burden this has been for them. I like to try to make them comfortable because oftentimes this is a pretty emotional thing.
Yes.
And then kind of go from what they know, what they have done, what kind of things they've tracked, if they're familiar with what potential barriers could be, and then just get a general history from each person about their lifestyle, some challenges that they've had in their health. That will help me to identify whether or not there should be a male focus or whether there should be female focus. And then a lot of it is taken just from taking a full medical history.
Now, let's hear of some success stories that you have had with some couples.
Well, the success stories, thankfully, are common enough that I really can't point out one particular individual.
That's a good thing.
It is. We can achieve success in nearly 90% of the couples that we approach. And so oftentimes, without necessarily getting too technical, when you get somebody to that point of a journey, it's extremely healing.
Yes, for sure. It definitely is. And you guys, at St. Gianna Clinic, you do things a little differently in the fact that, you are holistic based and, you take different steps, to see what the root cause is and work with each person individually, correct?
Yes, it's unfortunate that it is viewed as holistic now. It's kind of really a throwback to the way medicine is supposed to be.
Yes.
I mean, we really are, I like to use the term restorative. We're trying to find where the problem is and restore it to its proper balance to help make sure that people can achieve what their body's meant to do.
Yes, for sure. Now, for people at home watching and wanting more information, how can they reach out and schedule an appointment with someone at your clinic?
They can call the office directly. We have a pretty big presence on Facebook and on the internet. So we have a web page, and so they can start just by researching the St. Gianna Clinic in De Pere, Wisconsin.
Perfect. Well, thank you so much, Doctor, for your time.
All right, thank you.